As usual, we have our a presentation where we'll share some information with you, and then we'll open it for questions. We did have some emailed in, so we'll start with those questions and then any other questions that come up during the meeting. We're really trying to make these meetings more accessible to people who speak other languages. So if you want to try the closed captioning in another language, right-click on the closed caption box at the bottom of the screen. It's the CC with a box around it. A menu will come up, and then you'll click on Translate into English. A box will appear at the top of your screen where you can then choose what language you would like the captioning translated into. And we also have someone here to help translate questions for Spanish speakers.
Buenas tardes, mi nombre es Nadia Ugarte. Bienvenidos a la reunión de autoayuda y reunión familiar de DSP. Les estaré ayudando a traducir preguntas que tengan durante o al final de la presentación. Si tienen preguntas, pueden escribirlas en la parte derecha de su pantalla. Presione el cajoncito de abajo, por donde está la hora, o mándelas a dspdinfo@utah.gov. Para esta presentación, usted puede prender los subtítulos en español. Para hacerlo, presione el cajoncito que tiene las dos C en la parte de abajo de su pantalla. Presione English y saldrá un menú en el medio de la pantalla. Presione Translated Captions en la parte derecha para que el cajoncito se ponga azul y tenga una aspa. Presione la flechita en Translate to y seleccione Spanish. Luego presione la X en la parte de arriba y podrá ver la traducción en la parte de abajo. Esta reunión está siendo grabada, así que les pedimos que presione el botón rojo en la parte de abajo del micrófono para así no grabar ruidos fuera de la presentación. Si tiene preguntas y está usando su computadora, puede presionar el botón con la mano y presione el micrófono para poder escucharlas. Gracias. Back to you, Angie.
Thank you, Nadia. Before we get started today, we wanted to remind you that this meeting is being recorded and it'll be available Friday on the DSPD website. It's under the Individuals and Families tab and then the Be Informed and Be Involved heading. Please mute yourselves and type any questions into the chat box, or you can email them to dspdinfo@utah.gov. You can also raise your hand. We really just try to kind of manage any feedback to make this as easy for everyone to hear and participate as possible. For our agenda today, we'll go over some announcements, staff changes that we've had. We'll get an ombudsman update on the disability ombudsman role. We'll go over legislative updates for implementing funding that we received. And this morning we had, just so you know, we had a presentation from the Utah Pride on their neurodivergent support group. So if you are interested in that recording will be available Friday too. So we'll go ahead and start with our announcements. So one is that we have a new fiscal agent. I think many of you know already that Leonard Consulting is no longer contracting with DSPD, but we're happy to be able to maintain 4 fiscal agents. So our new fiscal agent is Premier, and we still have Acumen, Morning Sun, and Valentine. So those are available fiscal agents for people using self-administered services, whether you're in ongoing services or if you were to do self-administered with one-time funding while you're waiting. Also, we had sent out a caregiver compensation survey to gather information. You should have seen the survey come through your email. It's closed, so we're no longer accepting responses to the survey, but wanted to thank all of you who took time to fill it out. We're working to analyze the responses now, and then the information will be shared with partners like legislators and advocates so they can make informed decisions about caregiver compensation. And if you're interested in getting involved, in any way, like in legislative issues or advocacy, we recommend you contact one of the advocacy organizations, the Utah Parent Center, the Utah Developmental Disabilities Council, and the Legislative Coalition for People with Disabilities are all strong advocacy organizations for people with disabilities. And I think their information was just put in the chat, so you can access it there. And then we are developing what is a tool for people who are transition age called My Vision of Adulthood. It's something that's being developed through our partnership with the National Center Advancing Person-Centered Practices and Systems. It's a guide for people with a disability, family members, school staff, and teachers, as well as state departments to help. It's a resource for transition age students to help prepare for adulthood. We're finalizing it, and it'll be available on our website next month, and we'll share more about this in our October meeting. I'll turn some time over to Penny to talk about internet safety training.
Yes, thank you. We are working to put together 2 trainings to address safety on the internet. One will be more general training on just internet and computer safety. The other will be more focused on relationships online and dating, and those will be available. A recorded version will be available on the DSPD website, hopefully by the end of the month, and possibly some live versions of the training available in the future. So if you have any questions or are interested in a live training option, please reach out to me. My email is there on the screen, pscow@utah.gov. Thanks.
Thanks, Penny. So I'll just go over some staff changes in case you need to be able to get a hold of someone or have questions, you know who to reach out to. So Bryn Peterson, he's been focusing on employment for a while. He is now our employment planning and inclusion administrator, and Lisa Wade has been hired to take his place where he was, and she'll continue to help us on employment and planning. She brings a breadth of experience with her that we're really lucky to have. Pam Madsen, she's joining our Request for Services Committee. That's where requests are sent when people are seeking additional services or a change in services. We have Luann Jones on our intake and waiting list team, Brittany Quintana, who's also on our intake and waiting list team. Janet Hellickson, she is a caseworker on our community transitions waiver. That's our waiver that helps people transition from an intermediate care facility into the community. We have Mia Risa, who is a caseworker on our team that helps people transition from the waiting list into services. And then Amanda Barr supervises the team that helps people transition from the waiting list into services. And really, all of these people bring great attitudes, experience, insight. We're lucky to have several people with lived experience joining our team that just helps us stay focused on like families, people we serve, how decisions impact them. So we're really excited to have this group in their roles. I wanted to make sure you had their names in case you need to reach out. So I'm going to give some time to Donovan Bergstrom so he can give us an update on the Disability Ombudsman.
Thank you, Angie, and good evening, everybody. My name is Donovan Bergstrom. I'm a division director for the Division of Customer Experience, which is a new division with the Department of Health and Human Services. We have consolidated our Ombuds teams into this Division of Customer Experience. So we have the Ombuds for child protection, for long-term care, and then we're really excited about getting our new Ombuds program for people with disabilities. This was authorized last year in the legislative session, and we've been trying to get a great person, office director, person for this Disability Ombuds program, and it's taken a little bit longer than Angie and I have wanted. But we do have good news. We have a interview next week for a really good candidate, and so I'm very hopeful that we can get this person hired and then work through getting this new program set up. One of the goals that we have would be is with this one person being able to have stakeholder engagement to develop the scope for this. If you read the report that went to Health and Human Services Committee last year, one of the proposals for this Disability Ombuds program included a very large staff of potentially up to 20 people in a very big budget for that. We knew that this would just be a stepping stone to get this program started. So we have one staff that has been authorized right now for this program. And our goal for this upcoming year is get the office director hired, get the scope, get rules and operations in place, and then start collecting data on how we're doing with our constituent concerns. That's just a real quick overview of where we're at right now. Does anybody have any questions for me about this new Ombuds program? Angie told me that this evening group would ask more questions than the morning group. So I just need one question. They were pretty quiet too when I went over this in the morning.
Donovan, for anyone who may not be familiar with what the Ombudsman will do, can you just give kind of a brief overview?
Sure, thank you. Thank you, Katie. So our Ombuds teams, basically they are there to be a neutral party, third-party advocate for our consumers, really, is if we can frame it that way. And so it looks a little bit different in child protection than it does in long-term care, but I'll use a good long-term care example. Is that any of the residents at our long-term care facilities can reach out directly to a local ombuds and ask for help or support or make a complaint. And then the ombuds will follow up with the facility to help, negotiate if there was a problem, if it's a policy issue, or if it's just a recommendation. They'll work with that facility and with the resident to find a resolution. And the majority of the time, they come to agreements where the resident is satisfied with the resolutions that the facility, the ombuds, and the resident agree to a certain type of a resolution to what their concern is. And they also, they leverage their experience and other look at other options that they can come up with to help that resident. And so I see this the same thing. It would be more for somebody getting services or access to services, that this ombuds would be that third party that can help resolve any issues or concerns that they have with. It could be the provider, or it could be potentially a business, or it could just be a support that they need and get them connected to the right people. Okay, so it looks like we have a few more. Oh, thank you, Katie. You put some things in the chat. Was there another Oh,
looks like-
Lauren. I think Lauren had a question.
Do you know what? I actually meant to do the chat, but I'll just say it now. Any idea on about when you're going to make a decision on the caregiver comp? I know you said you're gathering the surveys.
On the caregiver.
The caregiver compensation.
Yeah, Lauren, we can address that later. Donovan's just taking questions about the ombudsman right now, but we will get to your question.
Yeah, Angie, I think I was going to get stumped on that one. I had no idea what Lauren was talking about, but I'm glad it's on the agenda.
Donovan, thanks so much for coming and sharing that information. And we are all, I think, looking forward to being able to have a disability ombudsman in our state. I feel like we both have questions come in and we're like, wow, well, we are ready for this role to be filled.
Yes, and we've both been pretty patient on this, and you know, I want our constituents to know that, you know, we've been trying really hard to get the right person in here, because, you know, we know that this program is very important. It's going to provide an important service to the community, and we just need the right person to get this off the ground and running.
And Donovan, there is one more question in the chat. Katie was asking about a number to call. Can you address that real quick? For the Ombuds program. So once we have this person in place, Katie, we'll do a outreach of what that number will be, and then that's still probably going to be a couple of months. And how frequent, Katie? I think you told me, how frequent is this meeting? Quarterly.
It's
Our
quarterly.
next October.
Okay, Katie, I think I'm pretty confident that I would have that information at this next meeting. And then also, Angie and I can work with you on outreach to our other partners with the information of where the number that we would be calling.
Thank you, Donovan. Thanks for spending the evening with us.
No problem. No problem. And Angie, are you okay? I've already sat through the rest of the presentation.
You're good.
I'm good. Okay. All right. Thank you, everyone.
Thanks. See you.
Bye.
Laureen, I think you had a question. Your hand, I don't know if you're waiting, if your hand is still up because it didn't go down, or if you're just waiting until the end when we're going to do the Q&A. Okay. Thanks. So let me check in and make sure. Jamie Douglas, is your...
Yep, I'm here and I think I'm working. Can you hear me?
Working, okay.
Woohoo! All right. So first,
Awesome. We'll give time to Jamie to give us our updates.
Thanks, Angie. So our legislative updates on the waiting list. So fiscal year 23, the legislature has funded $6 million to bring people into DSPD services. We have started transitioning monthly groups of clients into services from that waiting list. Services will begin July 1st for the first group of people, and we are very excited for the opportunity to support families. Another just quick reminder, 90% of this funding will be used to bring people with most critical needs off the waiting list. This means that people will be brought into services based on their placement on the waiting list. About 10% of the money will be used for the limited supports waiver. DSPD identifies individuals eligible for the LSW based on low needs assessment scores. Time spent waiting will be used to determine order of enrollment. Just a quick fact, we had some additional funds that we were able to provide to around 200 families from April through June. It was just a one-time respite support, but we were excited to be able to do that. We are continuing to bring people into services in those small groups. We've been requesting updated psychological evaluations for individuals who have been approved for funding. We're assigning around 50 to 70 evaluations to our contracted psychologists each month. The transition and assessment team and limited supports waiver teams are still very busy opening cases. We have assigned cases for the month of August, and we'll continue to assign cases the first week of each month. Can do one more, Marcy. So how do we transition people into services? So step one, you're going to receive a packet in the mail or email with information about completing Medicaid enrollment. There are 3 forms that you'll sign: ensuring informed choice of services through home and community-based services, the HIPAA compliance form, your person-centered profile, and I think that's it. Sorry, I lost my place. You can also contact the DSPD waitlist transition at utah.gov with questions. The team will help you work through that process. So step 2, your case will transition from your waiting list worker to a state support coordinator. Your state support coordinator will administer required assessments, including the UCANs, charting the life course tools, employment pathway tool, develop an initial and person-centered plan, and develop your DSPD service budget based on assessed needs. Step 3, you will find a provider and an external support coordinator to manage your case long-term. Your state support coordinator will inform you of the invitation to submit offer, process, and assistance in choosing a contracted provider and assisting you setting up staff if that's something that you're interested in. They will also add provider services to your budget, hold PCSP team meetings, and develop your goals and your plan. They'll help you find an external support coordinator and then transfer your case to that coordinator once all of the steps are complete. Thanks for some funding from the American Rescue Plan Act, we will be able to offer some limited services to people on our waiting list. It looks like it will be around, I think we said 2.5 years, right, Angie, at this point. So at least 1,228 people will be able to receive these temporary services. We're looking at pulling people in 3 separate groups and offering that service for a 12-month period. So some of the services that are available will be assistive technology, behavior services, transportation, employment services, caregiver compensation, and respite. So there are 3 separate groups that we're going to look at and pull from. So it will be the 12-month periods, hopefully starting in August and going through June of 2023. And then another group from July of 2023 to June of 2024, and then the last group of July from 2024 to June of 2025. That's a tongue twister. So the 3 separate groups that will be chosen, 1/3 will be based on the highest needs score, another 1/3 will be random selection, and the last group will be people who have waited the longest. We're going to break that into 3 groups, which would be 3 different age groups. So ages 0 to 12, 13 to 21, and 22 and up.
Thank you, Jamie. This morning, as I mentioned, we had Brittany Martinez from Utah Pride. She talked about, she just presented information on a neurodivergent support group and social club they have at the Pride Center. You can learn more about it if you go to the utahpridecenter.org. I think we'll put that in there along with her email. And we'll post the morning session on our website, so you'll be able to watch her presentation there if you're interested. So we're at our Q&A. So I'm gonna, as I mentioned, we had questions come in already, so I'll start with those that were sent in, and then we'll get through the questions that you have today. We have plenty of time to do that. So our first question was, I wonder if there's resources to help with getting guardianship for parents of adult disabled children. So the Utah Courts website provides general information regarding guardianship and conservatorship. And on the website, there are links to all the necessary documents needed to file for guardianship. So we'll get that link in the chat. Guardianship Associates of Utah offers classes to those interested in petitioning for guardianship, pro se, and we'll put their website in the chat as well. That's a resource that you can look to. And then the Self-Help Center through the court provides free legal help to individuals who are representing themselves. The Utah Parent Center has a great resource for guardianship. So we'll be putting these two links in the chat as well. And then in addition, the Utah Parent Center also provides free training classes on all transition topics, including guardianship. The next series of classes are being held every Tuesday in September via Zoom, so that keeps it as accessible as possible wherever you're living in the state. And you can register for those through the Utah Parent Center, and we'll put their link in there too. So hopefully with these resources that can help you get information you need. Our second question is, please describe what criteria might get a loved one on the DSPD services, not just on the waiting list. Our handicapped daughter isn't receiving any services from DSPD, but in 2 other states we lived in, we were immediately given respite care and day program services paid for. They mentioned some circumstances, right, that would help, right? We know that there are needs that there are situations that elevate needs in our lives, and also just acknowledge that they're grateful for services for like their SSI. So home and community-based services vary by state. Currently in Utah, funding for services is not immediately available. DSPD does try to offer one-time waiting list supports when possible. So we do have a committee that reviews emergency situations. So our Emergency Services Management Committee meets at least once a month to review specific cases. When someone is referred for emergency services, the situation is assessed to determine if there are any other resources available. That's the first step we take to be able to assure that we're maximizing our funding and reaching the most urgent needs. And then our ability to prioritize resources for people in an urgent situation is also contingent on available funding, the funding that we're able to use to help serve people in emergency situations is referred to as attrition. So if someone leaves services, that funding is used to help someone else. But of course, that's a finite amount. And the emergency criteria for the emergency services consist of homelessness, loss of a caregiver, and that loss of caregiver can be due to the death of a caregiver or just a change in their capacity to care for their family member. And when there are just not other supports that can help meet that need. The severity of the behavior support needs, and that's really looking at, is the person jeopardizing their own health or their family's health and safety? Are they posing grave danger to themselves or others? Another area is severe medical support needs. So medical support needs that are jeopardizing the person's health and safety, and there are not alternatives to meet those needs. and when current medical care prevents the family from providing other necessary supports. And the final area is abuse. So adult protective services, child protective services, law enforcement, or the Office of Public Guardian are involved. Those are all situations that are elevated to that Emergency Services Management Committee. The third question we have is, once I am approved for services, is there a way of tracking how much has been spent on my behalf so that I will be aware of how much could be recovered from my estate after I die? And can you give me details about how they determine whether a situation falls under the exception to estate recovery? For this, the best place for you to get information will be from Medicaid, or parties responsible for those collections. So there's a Medicaid website that's being included in the chat. It's their Medicaid Estate Recovery. The Office of Recovery Services also has a Medicaid recovery page on their website. We'll include that there. And those are the best places to start to get information. There's also a website with just some general estate recovery information. We'll include that in the website, but the first two, those are Utah specific. So it's the Utah Medicaid website, the Office of Recovery Services website for our Utah office. So those will be good places for you to start. The next question we have is, why is the PA1 code for the physical disabilities waiver recipients about $4 less per hour than the supported living SL1 code for those on the communities-based waiver? It seems that those on the PD waiver are being treated less favorably or differently, although require a higher level of care than those on any of the other waivers. So for our waivers, rates are established through a rate study based on the description of the service. And rates have received increases through new funding from the legislature. In fact, this year it was like a 19.5% increase. In our system, it has been some time since we've done new rate studies, and that is an area that we are discussing in our system. Also, the rates are established based on what happens in that code. So rates look different for different codes. The personal attendant is limited to performing assistance with ADLs and IADL activities, where supported living the purpose is to teach the individual life skills and independence. So they would have been established based on their descriptions. We have a similar question that's, why don't the physical disability waiver recipients have access to the homemaker, chore, companion, etc. codes? Really, it's that each waiver is developed to meet a particular need, and as a result, the services vary by waiver, whether it's from the aging waiver to medically complex children's, to the physical disabilities, to the community supports waivers, to name a few of our waivers. They all have a separate focus, and services are developed based around that. One more question that is similar is, why doesn't the PA1 code include laundry, shopping, heavy cleaning, meal prep, and cleanup? Again, it seems that those on the PD waiver are being treated less favorably or differently. So this answer is kind of similar to the previous two. The service codes have been developed based on the needs identified and the scope of each waiver. The waiver services are reevaluated at least every 5 years. But just keep in mind that any changes that require funding and legislative action would need to go through that legislative process. And as individuals, anyone can advocate for any needed program changes. Good places to do that are with the Disability Advisory Council, the Medical Care Advisory Committee, or reaching out to your representatives, legislators. You can also reach out to the advocacy groups mentioned earlier, such as the Utah Parent Center, the Utah Developmental Disabilities Council, and the Legislative Coalition for People with Disabilities. Our next question is, what is the division's intent for caregiver compensation going forward? Do you intend to continue it? Is the intent for caregiver compensation to be used in conjunction with other services? For example, respite, supported living, or in place of them? Thank you for providing the program. It has kept our family afloat. We have written to the legislature and taken the survey. If you've already contacted your legislators and taken the survey, then you're on the right track. Caregiver compensation is currently funded by the legislature through June of 2023. And we don't know if that funding will be continued after that, but the information from the survey that you took will be communicated to legislators so that they can make informed decisions about the program. As the executive branch of the government, DSPD can't advocate for any funding that isn't in the governor's budget, and that budget typically comes out in December. And the intent of caregiver compensation is much like the rest of DSPD's services. All service usage should be based on the unique needs of each person. For some people, that may just be caregiver compensation, but some others may need additional services in their plan. We do know if caregiver compensation were to be ongoing, there are things that we would have to address. Right now, caregiver compensation is allowed through what's called the Appendix K. It's a modification that we were able to do for our waivers to allow flexibilities that we don't have in them during the pandemic. And I know it's like 2.5 years since that was created, so it probably feels very different than it was at that time, but that's still the authority that we're operating under to have something be, if it were to become an ongoing funded service, then there are things that we'd have to address, like what extraordinary care looks like, because right now our extraordinary care is like health, safety, and wellness related to adapting to the pandemic. So there is kind of a little bit different. So caregiver compensation is a little bit different than all of our other services because of this, because it's an exception right now in a sense, right? It's an accommodation that's being made. But we do know that there are people who are interested in this, and that's part of why we're also doing the caregiver compensation surveys. So we have good information to be able to answer questions and be able to address things as they come up. So a follow-up question to that is, you're saying caregiver compensation has been funded by the legislature through June 2023. However, it has been cut off for me and other families despite appeals. Our needs haven't changed. I last received caregiver compensation for the first half of this past February 2022. Have rules changed? And what can we or our caseworkers do differently to start receiving this desperately needed help again? So caregiver compensation is still available as a service option for individuals who receive waiver services through DSPD. So if it was like one-time funding, it's likely just that one-time funding was exhausted. But if it's an ongoing, if you have ongoing services, it's still one of the options available. So work with your support coordinators if you have questions about your specific situation. In general, when reviewing requests for caregiver compensation, the Request for Services Committee looks at the overall health and safety needs of the person, along with all of the available services and resources available to help meet that person's needs. each individual has unique health and safety needs, so the total service package varies by person. If you have questions about a denial that you have appealed, please contact DSPD hearings at utah.gov. We'll put that in the chat as well for information on the appeal process. Okay, so the next question is, for families that have more than one child receiving caregiver compensation, would there be a way to use a code like RP7 for parents to watch multiple children if caregiver compensation becomes permanent? So these are distinct services. Because the purpose of respite is to provide a break for the caregiver, it isn't included in something that could be provided through caregiver compensation, right? Because that's paying to provide the service. And at this time, we don't know exactly what the scope of the program would be if it becomes permanently funded. So currently, stakeholder input, including this information from the survey, is being gathered to help us gain a better understanding of how the program works and what challenges families encounter as they implement the program. So we appreciate your question and the feedback that you're giving us. Let's see. So our next question is, we are confused as to why Utah state funds that are supposed to be made available to all people with disabilities are withheld from thousands of qualified Utah residents with disabilities. So I'm assuming this is related to the fact that we have a waiting list, and really we acknowledge that there are people who are not even on our waiting list who may need or access services or apply for services in the future. It really is having the resources for funding. So it's having enough funds to be able to pay for services. This year, our legislature appropriated $6 million to bring people into services off of the waiting list. And that is like the biggest amount we have seen, at least the biggest amount I've seen appropriated from our legislature. There's the question, sorry, I didn't realize how long it was. It also just notes that there are around 5,000. There are over 4,000 people waiting for services. And our waiting list does continue to grow even as we bring people into services. All of the funding that we do receive goes direct, right? So when we that $6 million, all of that money is going to bring people into services from the waiting list. When we have attrition, so when people leave services, that money is also used to bring people into services, right, from the waiting list. So that the funding that is received is serving people, but we acknowledge that the funding that we have is not sufficient to serve everyone who is waiting for services. I don't know if any of you had a chance during the general session at the beginning of this year to listen. I do feel like our social services appropriations subcommittee, this was definitely a conversation they were having. They're very interested in understanding, like having a strategy or looking at how to approach and address the needs of our waiting list. That's why they put forward such a larger amount of funding than they have in the past. They're having discussions about where are resources that could help make that happen. I probably should finish reading this question because I'm just seeing, it says also, why on earth isn't a portion of the funding being shared amongst all qualified recipients that are residents of Utah? Why is it set up as an all or none? Meaning if you're in the system, you get full coverage benefits. And if you're on the waiting list, you get absolutely nothing through the state DSPD program. This huge disparity gets brought up in most of these meetings, but very few course corrections seem to happen. We have frequently heard from families that the all or nothing is hard. And that was the purpose for implementing the limited supports waiver that was just approved this January. By our legislature approved it earlier. It took a little bit of time to get through the review processes in the Centers for Medicaid and Medicare Services, but that has started, and it's meant to provide the services earlier for people. So it isn't an all or nothing. It's a waiver that has a cap. It has a menu of services that people can use when they make the most sense for them. They can work through those services. It's a smaller service package than our community supports waiver or our acquired brain injury waiver, which have really big service options among them, and can have pretty large budgets. And DSPD was also given intent language to conduct a study. So it's really, I guess, like our Department of Health and Human Services. We're going to be conducting a study on long-term services and supports, or contracting for that. And the study will be looking at what are the service gaps, and it'll ultimately recommend a roadmap of sorts for how our service systems can better serve the needs of individuals across our states. We're really hoping to learn from that as well. I'm sorry, it's frustrating to probably hear that we don't have a solution today, but we definitely continue to work on it. And when we see things like the request for the study comes from our legislature, I feel like that demonstrates their interest in finding solutions too. So the next question is, I was told today this year's people have already been selected and no one else will be picked. My daughter is currently at waitlist position 602, but there is no funding for her this year according to her waitlist person just today. Is this true that all waitlist people are already picked for this year? So we have funding to bring about 400 people into services. Some of them are based on the most critical need. 90% of our appropriations was for the most critical, and 10% was for the limited supports waiver. So we've been working through the top of our waiting list to make sure that we have updated psychologicals, the necessary information that we need to have in place to bring people into services. So they are already working through those. One thing to keep in mind as we talked about attrition, it often goes just through our emergency services, but there have been years too where the emergency needs did not utilize all of the attrition funding, and we were able to bring in people from the waiting list, just working through our waiting list as well. So hopefully that kind of helps you know where that is at. The next question is, how do you know where you are on the waiting list? So you can reach out to your waiting list caseworker to find out your ranking. And if you don't know who that is, you can call the intake line at 1-844-275-3773. So the next question is, I'm confused why DSPD wants and has taken away hours of services. So the planning, so a support coordinator should be planning with each person and their support system, identifying their support needs, and that should be what's in their plan. I'm just wondering if this is related to the budget utilization reviews. So if it's, so anyway, so people's plans should represent what their needs are. Where one of the things that we are doing that we have been directed to do is what is called a utilization review. And this is actually just looking at service, like underutilization of services. So if someone has not, and we're looking over like a 3-year period or more, because we know things have been a little bit different during the pandemic and how people have been able to use their funding. So it reviews how people are using their funding, and if it hasn't been used, we'll notify the support coordinator that we intend to adjust the budget to reflect what the utilization has been. And they have an opportunity to like justify if there is a reason why it hasn't been used but will be used. So if they agree with it, that adjustment is made. And if they have a concern, we go through a process, and people have the right to appeal if the determination is that we don't see the need based on the utilization. We look at the log notes from support coordinators. So our desire is to make sure people's needs are met, and also assure that we are accountable and responsible for our budget. As we've been discussing, we have a large waiting list. We have varying needs across our system. And so it's really trying to make sure people continue to get their needs met, and we're able to demonstrate accountability for the funding we receive, and really just try to assure that we're able to maximize the number of people's needs that we're able to meet. So the next question is, why are the waiting lists based on a questionnaire with no personal visits to actually review the personal true issues that cannot be seen through these simple and broad questions? In 7 years, my daughter has never had a personal interview or home assessment. We've had this question come up before as well. So one of the realities for us is that our intake waiting list workers have caseloads of about 600 people. And we want to make sure we are updating this questionnaire every year, because we know it's important for everyone on the waiting list to be well represented. So we make sure we're doing that. One thing we have discussed is the possibility of like doing the questionnaire virtually. That gives a little bit of opportunity to see more. But that is a big part of it, is just capacity. And our resources truly are primarily focused on service delivery. So that's the best answer to that. I don't know, Jamie Douglas, if you have any other thoughts there.
No, I do. I want to encourage people, though, to reach out to their waiting list caseworkers and provide any additional information. We don't just use the answers from the questionnaire. We do also take a lot of notes and take a look at the full assessment that we're doing. So please tell your waiting list worker everything that's going on for you if you feel comfortable. You know, this information isn't shared with anyone. It's for DSPD purposes only. And so we really do want to find out what other supports are needed, other community resources that we can get you connected with. So the more information, the better.
Thanks, Jamie. Those are all of the written questions we have. I don't know if there are any other questions that you just want to ask, and feel free to raise your hand or. So Ryan, I'm just seeing your comment how like your daughter's position moved. I don't know exactly like what time frame you're referring to, but I would anticipate it was probably at the time we had our needs assessment questionnaire updated. We contracted with the Chem Gardner Policy Institute, and they held to develop a tool that was meaningful for families and captured all of the needs. They held focus groups. They got feedback from multiple, they held multiple group meetings with families to identify like what are the things that lead to like the greatest need. And they kind of explored like what should be included. So some things that were not included in the past that were included following that was their behavior supports had always been well captured, but there was a need to also capture like medical support needs. Feedback from families included just acknowledging that, yes, a family may have to chase their family member down the street, and that gets captured within behavior supports, but a family can also be up all night repositioning or transferring and lifting and helping their family member, which is just as physically fatiguing. So there were things that were added that captured a broader need that then, it did affect positions for people on the waiting list. And we knew that when it was rolling out. We tried to make sure we held meetings and sent communications so people knew that they could potentially change their position on the waiting list. Another big change is that there used to be a cap at which point like time on the waiting list capped out, but now it's like literally every day is weighted and counts. So I don't know if that helps you understand that at all, but there is but that is what I am anticipating was likely part of what affected that. Just give me a second to look at the chat. Okay, so there's I mean, we can definitely take the feedback of looking at like what would it take to have some home visits happen. We can at least assess like kind of what that capacity would take for sure. So there is just a comment around being confused about the services. I hope it's clearer. If not, please reach out to DSPD info and we'll get you connected with someone who can kind of talk you through any questions you have. Looks like some advice from peers. I agree, wait times are difficult. Any other questions? Sounds like someone came off of mute, or maybe it was just like some feedback. So,
Angie, it looks like Michelle had a question in the chat about caregiver compensation.
I was just wondering if I didn't realize that it was still going on, possibly. That I thought it was just a one-time only for my situation.
So if you're on the waiting list, it probably was a one-time service. If you are in services, the legislature provided funding, approved funding that takes caregiver compensation through this fiscal year. So July 2023 to July 2022 to June of 2023. It's still something that we have funding for that time. Okay, if there are no more questions, we'll go ahead and we have our Disability Advisory Council coming up. It's on August 23rd. The public is always welcome to attend, but this is specifically our public input meeting for anyone who wanted to participate and come give feedback. Our next self-advocate and family gathering is going to be Wednesday, November 9th. And just as a reminder, you can find our past recordings on the DSPD website under Individuals and Families, and then under the Be Informed and Be Involved heading. If you wanted to look up information on past Disability Advisory Council meetings, those can also be found online. And I think that link was just put in the chat as well. So thank you all so much for coming tonight. Thank you for your questions and for your recommendations and suggestions. So we definitely need to hear from families and hear from people we serve so that we can make sure our system is responsive. And I know that sometimes it's not maybe not as fast as we'd hoped for, but we're definitely diligently working to make sure it's meaningful and helpful for people. So thank you for coming and participating, and I hope you have a great evening.